Multivitamins were associated, here's where it gets really interesting, ladies and gentlemen, with a 2.4% higher risk of earlier death. Vitamin B6 gave a 4.1% higher risk. Folic acid gave a 5.9% higher risk. Iron gave a 3.9% higher risk of death. Magnesium gave a 3.6% higher risk. Zinc gave a 3% higher risk. Copper gave an 18% higher risk. A slew of some more findings. I'm sorry I have to read this, but there's so much data here. A large clinical trial of about 15,000 male doctors taking vitamin E and C for up to 10 years found that neither supplement had any effect on cancer rates, including cancer of the prostate. 14,000 doctors took vitamin C and E for 8 years and found they were no help in heart disease. Last month, a major trial studying whether vitamin E and selenium could prevent prostate cancer was stopped because it was proving to increase the rate of prostate cancer. Researchers at Memorial Sloan Kettering Cancer Center in New York studying the effect of vitamin C found that just like vitamin C, again, from its natural state, protects cells, it also protects cancer cells. These are the latest studies. Yale, Professor David Katz, who's the director of the Prevention Research Center at Yale, no longer takes a multivitamin, no longer recommends multivitamins to his patients. In a study of Swedish women, which he quotes, those who took multivitamins were 19% more likely to be diagnosed with breast cancer over a 10-year period than those who didn't. A 2007 paper in the Journal of the National Cancer Institute found that men who took multivitamins along with other supplements were at increased risk of prostate cancer. I'm sorry, 1 second. And other research has linked excessive folic acid intake to higher colon cancer in people who are predisposed. And here's a quote from Dr. Katz. In terms of a risk-benefit ratio, says Dr. Katz, why would you accept even a tiny risk if you're not getting any benefit? Guess who also no longer recommends multivitamins? Kathleen Fairfield, Associate Medical Director at Maine Health Center, one of the two authors from the Journal of the American Medical Association in 2002. Folks, it's not my opinion that multivitamins are bad for you. It is becoming the opinion of people who study it. And when I was at the American College of Preventive Medicine symposium in February of 2011, and the chief nutritional speaker finished speaking, I went up to him and said, which ones do you recommend of the multivitamin supplement? And he said, none. And that was February. And so I've learned a lot since February, because when he said that to me, I, like most of you, thought multivitamins are an insurance policy. They don't possibly do any harm. Well, now we know that's not true. They do harm. They are not an insurance policy. In fact, there is no insurance policy for not eating well and taking care of yourself. That's the most important thing to take away from what I've said so far. You have to take control of your lives. Can you do it on your own? I think it's a trick to do it on your own, and I'll tell you what I mean. I see an article written by the chief nutritionist at the National Institute of Health, and she writes, if you want to take care of yourself, you need how to read labels well. And I write back to her, if you want to take care of yourself, you need to eat foods that don't have labels. And she writes back, oh, yes, of course, we advocate that people eat lots of fruits and vegetables. Well, that's great. Which fruits? Kiwi, that reduces hypertension? Oranges, apples, bananas, melons? Which fruits? Nobody tells you. Every article, eat fruits, eat fruits. We know that each fruit has different vitamins. And if you want to get all your vitamins, you got to mix up the fruits. The same with the vegetables. All vegetables are not created the same. A potato is not a carrot, is not a pepper, is not lettuce. They're different. And yet everybody in America is going to tell you eat more fruits and vegetables as if that in and of itself is enough. Or they're going to tell you take this, don't take that, as if simply telling you it's enough. Because let me tell you, it's not. And here's one more study from The Lancet, which is another premier journal. So you say, oh, you know, Dr. Charlap, the other studies were a few weeks ago, a few months ago, a couple of years ago. How about yesterday? In fact, the date on the article is January 2012. That's how new it is. And what did they find? In a review, neither antioxidant vitamins nor B vitamins were associated with stroke prevention, but a healthy diet, such as the Mediterranean diet, did appear to diminish risk. Randomized trials have shown that beta-carotene, the biologically active metabolite of vitamin A, won't prevent stroke. In fact, it appears to up the risk of all-cause cardiovascular death. Similarly, large randomized controlled trials have shown that C and E won't prevent stroke either. Vitamin E may even increase the risk of death. Calcium could also increase the risk of stroke. And this is a big one, folks. Trials that have shown that it may increase the risk of heart attack by 31%. Okay? So those who think that I'm a little bit off kilter when I tell you stop taking your calcium because it's associated with increased risk of heart attacks, this is a study just published in The Lancet, one of the premier medical journals. You don't need to take calcium supplementation unless you're into osteoporosis and you've already had fractures where you're not worrying about imminent death from the calcium, you're worried about the next bone that's going to break. And again, I'm not giving medical advice here. If you want medical advice, you have to come in and we have to look at you as a person. There is no one-size-fits-all when it comes to medicine. And that's the whole point of the annual wellness visit. That's why Medicare began reimbursing for it. Because until now, doctors never sit down with you, ask you what do you eat. Now, why does it make a difference what you eat? Because let's use an example, calcium. How many women here have been recommended to take calcium by a doctor? How many of you were asked, what do you eat? So the doctor could determine how much of that calcium do you get from your diet? Why? One person in the back. Why? The doctor takes some time, the nurse practitioner takes some time. She can figure out what you're eating. Having a cup of milk.
She never learned it in medical school.
Okay, well, one person says because they didn't learn it in medical school. Well, they don't have the time. It doesn't matter why. That's why the government has created this service so the doctor will find the time, not focus on a problem you have already, but help you avoid the problem. It's a tragedy that Americans are not taking advantage of this benefit. Okay. So do you need to take anything? Vitamin D3. So I'm going to tell you two quick stories. A patient came to see me last week, and of course she knew that she's supposed to take vitamin D3 because you read it everywhere. D3, D3, all the time. And first of all, not D2, D3. But of course she had Centrum Silver, and we'll talk about that a little bit later. She had a vitamin D, and then she had a calcium mixed with a vitamin D. So, is it a problem to take so much vitamin D? Well, I put up this chart for the box on the bottom. The answer is yes. Vitamin D in high dosages is toxic. Toxic. Just because you need some of it doesn't mean you need a lot of it. And guess what? You can get vitamin D naturally. Expose your midsection 15 minutes of sun a day. And you got all the vitamin D you basically need. Okay? And guess what? Most of the foods you eat are fortified with vitamin D. So do you need to be adding extra vitamin D? No. Probably not. The only way to know for sure is to have a blood test. But probably not. But like everything else in our society, suddenly they want you to rush out and buy all the vitamin D. One of the preventioniers worked for a vitamin company for 8 years. Okay? And whenever 60 Minutes was going to do a report on something, the vice president of that company got a heads up, and they would go and buy all that product and have lots of it on hand because they knew that the next day they were going to sell it out. So when 60 Minutes did a report on melatonin, how great it is, the next day all the melatonin was sold out. Okay? And to give you another anecdote, the same gentleman shared with me that he was a senior executive in that company, and he would visit the different offices, branches, and one day he was at a branch, and he sees this guy is recommending one thing versus the next thing, and the patient says, but yesterday you recommended this. He said, no, this is the thing you should take, I'm sure. And when the patient walked away, the customer, this executive asked the guy in the store, why did you change your recommendation? And he said, well, they took the commission off of this product and they put it on this product. And I'm not going to mention any names because I don't want to get sued, but a very large company that promises to help you live longer, okay? I interviewed 2 of their senior executives. And when you call them up and you say, here's my problem, they will recommend to you whatever is the latest product that's popular for them. In fact, the people working for them described them as unethical. And yet they are over $100 million company giving medical advice. So you say, why would somebody work for an unethical company? Because they pay them exceptionally well and they can't afford to leave. And that's why they wanted to come work for an ethical organization. But I have trouble with that. If you think somebody's unethical, I don't think you should work for them for any amount of money. Okay? You can't see people needlessly suffer by recommending things to them that are inappropriate. So what are the recommended dosages of vitamin D? Less than 70, 600. Over 70, 800. That includes what you get from your diet. Okay. Yesterday, I'm leaving the office. I was going home to practice my speech, and I see a lady pushing a shopping cart in the parking lot. And it's a strange thing to see a shopping cart in our parking lot. I say, where are you going? She goes, I'm going to the bank. She goes, where are you going? I said, I'm going home. She goes, where do you live? I say, Boca. I say, where do you live? She says, Delray. I say, very nice. She says, can you give me a lift home? I said, okay, why not? I'm in this to help people. She needs help. She said, I missed the bus from Walmart to take me back home. You're a godsend. Oh, sure. So we're driving, and I said, you know, I've got her with me. I might as well do what I do. Hey, do you take vitamins? She says, matter of fact, I do, and I have the list here in my purse. She pulls out the list for me, and of course, she's taken 3 types of vitamin D as well. I don't know about you, I call it misuse. Okay? These marketers have you spun around their fingers so tight, you don't know if you're coming or going. That's why everybody can afford to sell this stuff. It's all marketing. They're fooling us. Well, the people after today in this room, you're not fooled anymore. You now know the truth. Some of you have been taking this stuff for years, okay? And you think this is what's keeping you alive and this is what's keeping you healthy. No, you're keeping yourself healthy, not these little pills that you pop in your mouth. B12. If you're a vegetarian, it is very difficult to get B12. But guess what? If you eat fish, not so difficult. Chicken, not so difficult. So just because you don't eat red meat, you don't need. And you actually need very little B12. You need about 2 micrograms of B12. And again, many foods are fortified with B12. I can't take it anymore. I was speaking to a guy yesterday who does commercials, and I said, can I start the commercial with a primal scream? Ah! I can't take it anymore. What they're doing to us in this country with the food and the vitamins and the supplements, trying to trick us at every turn. Okay? You need to leave today. You need to tell your children, your friends, the truth about what's going on. We are being misled by these marketers. We don't need to pop pills to be healthy.